Welcome to today's webinar, Embedding Carer Recognition and Support Through Legislation. My name's Elena Katrakis. I'm the CEO at Carers New South Wales, and it gives me great pleasure to host today's webinar with some great panellists. We have Professor Luke Clements from the UK, Alison Applebaum, PhD from New York, and Kate Hogarth from Scotland. I'm going to introduce them in a bit more detail later, but I would like to start off today to acknowledge the traditional custodians of the land on which we're meeting today. And for me, I'm in the south coast of New South Wales at Nowra, and it's the traditional owners of the land from the Yuin Nation. And I also want to pay my respects to elders past and present, but also acknowledging the unique experiences of First Nations carers, not only in New South Wales, but across Australia. Today, we're talking about legislation. To give you a little bit of context to what's happening in Australia, there's a lot happening. So legislation, as we know, is a key way in which carers can be identified and provided with rights and entitlements to support their wellbeing. In Australia, we're currently in the middle of extensive legislative reform from a range of different perspectives. So only last month, the final report of last year's parliamentary inquiry into the recognition of unpaid carers recommended a number of amendments to Australia's Commonwealth Carer Recognition Act 2010 and other related pieces of legislation, including, importantly, updating the definition of carer in the Act, strengthening the requirements for public service agencies, and the establishment of a complaints process related to breaches of the Act. The committee's recommendations also stipulated that the new National Carer Strategy, announced by the Federal Minister for Social Services in October 2023, should give effect to the principles of the Act. And I happen to be here in Nowra, about to head to a carer consultation around the new National Carer Strategy, which is exciting. So at the same time, new legislation in Australia is also being developed to govern the design and delivery of aged care and disability services, building on the findings of multiple reviews and royal commissions that have identified necessary legislative change. These new laws will undoubtedly affect family and friend carers, and it's imperative that those of us with knowledge of carers' needs and experiences inform and feed into these legislative reforms. We're also in the midst of a review of the Fair Work Commission of the modern awards provision relating to work and care, following on from a number of inquiries into the status of flexible work and leave entitlements available to carers under our national employment legislation. We also have the New South Wales Anti-Discrimination Act 1977, which contains provisions for carers, is also under review. So we're not going to be speaking in detail about all of these local developments today, but we'll be hearing from our international guests about similar developments in the UK and the US, with the hope of learning from their expertise and international perspectives to inform the changes going on in our own context, of which there is many. So for the rest of the session, we're going to hear from Luke, Kate and Alison. I'm going to ask them a range of questions to draw out their perspectives on how legislation can be used to improve recognition and support for carers, and what some of the challenges and considerations should be in developing, amending and importantly implementing legislation that affects carers. We'll aim to have some time at the end for questions, so please note any of those questions in the chat or via the Q&A function. So to introduce our panellists in a bit more detail, Professor Luke Clements, who I've had the pleasure of meeting a couple of times, both here in Australia, but also in the UK, is a Cerebra Professor of Law and Social Justice at the School of Law at Leeds University. He was previously a practicing solicitor with over 40 years' experience and has also conducted extensive research on the role of the law in exacerbating and combating the social exclusion experienced by people living with disability and their carers. In his capacity, he has also contributed to the development of multiple parliamentary bills in the UK. So welcome, Luke Clements. Our second panellist is Alison Applebaum, PhD, who's a clinical psychologist specialising in the mental health of people affected by cancer. She's an associate attending psychologist at Memorial Sloan Kettering Cancer Centre, an associate professor of psychology at Weill Cornell Medicine in New York City. She is also the founding director of the Caregivers Clinic at Memorial Sloan Kettering, which provides targeted psychosocial support to carers of cancer patients. Alison recently also published a new narrative non-fiction book, Stand By Me, A Guide to Navigating Modern Meaningful Caregiving. Thank you, Alison. And our third and final panellist today is Kate Hogarth, who is Head of Policy and Communications at Shared Care Scotland, which works to influence policy, research and practice to improve the quality, choice and availability of short breaks from caring across Scotland. Kate's primary focus is ensuring that quality, trustworthy information about short breaks is available to carers and helping to shape what short breaks in Scotland look like into the future. So we have an absolute wealth of experience and diversity amongst our panellists today. So thank you so much for joining us. I'm going to start off with a question to Luke to get the ball rolling. So Luke, as we said, you've been involved in the development of a number of parliamentary bills in the UK relating to carers, and you've spoken and written extensively on caring as a human right. In the UK and internationally, what have been the major trends in recent years in carer-related legislation, and what do you make of these trends?
Thanks, Elena, and thanks for inviting me. It's a real privilege. Well, I'll really speak about England, although when the story starts, devolution hadn't happened between England and Wales and Scotland and Northern Ireland to the degree it has today. The major trend has been recognition, I suppose, and it's probably a global trend. Governments are very happy to recognise carers as existing. So the UK is very early off the sort of starting blocks in '95 with, as you say, the Carers Recognition Act. A lot of resistance to that act, whereas all it does is just recognise carers. And since '95, we've had an increasing flow of legislation, which I characterise as form without substance. It's the government trying to appease, I think, carers with opiates, a recognition of process rights, of being assessed and being told that if their assessment is such that they cross the hurdle of eligibility, then they have a right to support. But that support is always means tested. And then they're also told that they'll have increasing rights on employment, to have time off work if there's a crisis or there's somebody in hospital or something like that. But that time off is always unpaid. And so what we have is sort of this increasing conversation about carers but nothing in terms of substance. So it's what I think Nancy Fraser calls progressive neoliberalism, where you talk the talk of rights, but you walk the walk of Goldman Sachs, basically. And we don't really, we end up with a situation where we've got sort of gold standard legislation. Now carers in England have the same rights to support as disabled people. Both adult carers and young carers. But in the last 30 years, I would say the situation in terms of health, wealth and well-being of carers has got significantly worse. We've got significantly more unpaid carers, and many of them are living in very poor health. So what we need, of course, is not just recognition and opiates. What we need is serious social welfare support. So we have a carers allowance in the UK of £80 a week. In England, in the UK, it's 100 American dollars and 150 Australian dollars. But you lose that almost immediately if you work, if you're not on a very low income, or if you go to college, something like that. So it's highly conditional. Whereas in fact, what carers need is a non-means tested significant social welfare payment for giving significant amount of care. I mean, this carers allowance is triggered by 35 hours work. And there needs to be the same sort of issue about carers being able to stay in college or education or training without immediately losing those rights. And there needs to be benefits for carers who take breaks from work, which then compensates them for the loss of wages because it's poorly paid. And all of those things, there's just been no movement on at all in the last 30 years. And I don't imagine there will be in this current austere world. So I'm fairly bleak on that. And I think the carers need to get much more radical about saying that, you know, we're just tired of this form. We want some significant substance. And actually, if you give us that, it will be good for the Australian economy, the British economy, the US economy, curiously. But it's getting that substance that needs to be the next phase, in my opinion.
Thanks, Luke. I mean, it is interesting. I mean, it's not always just about recognition. We know that, but that's often what the response often is kind of like the starting point. And it is disappointing because I suppose we do look to the UK as being sort of streets ahead us, as you say, having the gold standard legislation, but it is the substance behind it. So yeah, I think lots of food for thought within that. Kate, just to go to you, obviously you're also in the UK and Scotland. So have you seen, I suppose, that sort of same trend within Scotland? And if you could tell us what unique developments have been taking place there from that perspective.
Thank you, and thank you for inviting me along today. It's a real pleasure to be here with all of you. So very much what Lucas said is very familiar here in Scotland, and I would say that we are making some progress from recognition towards rights. The Carers Scotland Act came into being in 2018 and set out quite a few specific rights for unpaid carers, entitling them to, and that's anybody that identifies themselves as a carer, to an adult carer support plan or young carer statement, and the right to support for eligible needs. They also had provisions around being involved in hospital discharge of the cared for person and to be involved in services. From my perspective at Share Care Scotland, the particular thing around the adult carer support plan is that it must consider whether the form of support that a carer needs is a break from caring. So that was a significant step forward in terms of short breaks and respite. But as Lucas said, I think there is a gap between policy and implementation. We have these fantastic policies regarding carers, and local implementation can be very varied and very patchy, particularly where we've got things like eligibility criteria that are set at a local level. So a carer in Shetland Islands, for example, might experience different services to carers in the city centre in our hubs such as Glasgow or Edinburgh. Another significant development that's coming our way in Scotland is a new national care service, which was brought to Parliament in 2022 and passed stage 1 of the legislative process earlier this year. It's a vast piece of legislation and really wide-reaching, but what it does bring forward is a right to a break from caring, which is a significant step forward for our unpaid carers. It is really interesting development. It talks about carers having the right to sufficient breaks from caring to enable them to have rest and leisure and time. And it also removed eligibility criteria. So the right to a break is that you'll have sufficient breaks. It's not that you have to meet a certain threshold or standard. It's, are you getting sufficient breaks? So I think that that's a real positive move forward. However, I would couch that with the fact that there is a nervousness around, will we once again have these fantastic rights, and the implementation and the experience of carers actually be very different from that. Just one other thing to mention in terms of the Scottish context is that we do have our statutory services, as you would expect, but we also have a really vibrant and thriving third sector, which provides a huge amount of carer support in Scotland. And some of these, for example, our network of carer centres are often commissioned by the local authority to deliver carer services. So I just think that give a shout out to the third sector, but it's important to acknowledge the really significant role that they also play in delivering carer services. So like slight sidestep to sort of statutory legislation, but their role can't be underestimated.
Yeah, thanks, Kate. I mean, it's, you know, a right to a break for carers is again very impressive. It is about that, you know, implementation, which I think we'll probably come to talk about in a little bit more detail. But yeah, great things happening there in Scotland as well. But again, the complexity of delivery of those supports and services for carers to make it meaningful. So, Alison, we've heard about some of those, you know, challenges within the UK from both Luke and Kate. That variation obviously would be in a much bigger scale across the US states. Lots to grapple with there. Can you tell us about the CARE Act and its update to date in the US?
Absolutely. And thank you so much for having me. I'm so excited to be joining from New York. And please forgive me if I use the word caregiver instead of carer, as that is the word that we use here in the United States. So actually, importantly, this coming year, the National Alliance for Caregiving in the United States is going to be discussing the language we're using and thinking through how we describe family caregivers or carers. So the CARE Act stands for the Caregiver Advise, Record, Enable Act. And the CARE Act was introduced in 2016, and there's been a state-by-state approach taken to approve it. The CARE Act has 3 provisions. The first is it says that when a patient is hospitalized, admitted to a hospital, that their caregiver's contact information, name and phone number and email address, should be documented in the medical record of the patient. The second provision is that that caregiver should be notified when that patient is going to be transferred or discharged from the hospital. And number 3, and I think most importantly, it states that when a patient is going to be discharged, that caregiver should receive training and education so that they know how to take care of their care partner upon discharge home. Currently, the CARE Act is passed in 45 states and territories. I feel cautiously optimistic that if we were joined together a year from now, I might say it's passed in every state. But the flip side is that just because it's passed in a state doesn't mean that it is consistently implemented. And that's really one of the challenges that we find, that even when it's passed, there are individuals across hospital systems who are not even aware that the CARE Act exists. There are certain situations, disease groups, treatments in which the CARE Act is very consistently implemented. And those, not surprisingly, are those illnesses and treatments that actually completely depend on the presence of a family caregiver. So a great example of that, I work in a cancer center, is a stem cell transplantation, which here in the United States, these are increasingly conducted in the outpatient and homebound setting, meaning a patient gets their transplant and they go home. But in order for a patient to actually be eligible to receive that transplant, a caregiver has to be available and actually sign a consent form and say, I, as a family caregiver, am going to be available 24/7, potentially for the next 3 months, which we all know is such an incredible ask. Now, in situations like this, of course, that caregiver is receiving training and education and even support. But that's not the norm. And so while it is passed in 45 states and territories, it's not consistently implemented. Not all of my patients are receiving that training. And I can say for myself, I was a carer until 2019, after the CARE Act was passed in New York State, where I reside. And I never once actually received that training or education upon my dad's discharge from the hospital.
Yeah, again, it's the implementation and the follow through of these things, because I think there's some fantastic elements to all of these pieces of legislation, and giving those, rights to breaks, assessment, training, all of those things. But it does come then down to that, how it happens on the ground, and it's not just a piece of legislation that's sitting on a shelf or, online in the computer somewhere. So, Luke, you've previously commented on how legislation can give carers greater visibility and a sense of identity, but it can also entrench the outsourcing of risk and responsibility to carers, which is what Alison's really just been talking about a little bit. How can we ensure that we develop and implement legislation that supports carers' well-being?
Yeah. I'd just like to pick up on what Alison said, because it's just so interesting, because the UK, or England, let me say, sorry, we have a sort of pretty neoliberal government, and it's showing great interest in the US CARE Act, the sort of template act. And I think, although there's sort of aspects to that which seem to be fairly positive, it's really what you were saying, Elena, that it's an outsourcing of risk. I mean, the outcome's about, I think, and Alison will correct me, but I think something like $81 billion a year is spent on Medicare because of delayed transfers from hospitals, particularly of older people. And the whole point about the CARE Act is to get people out of hospital quicker, which, is often a really positive thing for patients and families. But it transfers risk from the state to a named carer, has to be named. And that person has to have the skills to do things that historically would have been done by nurses or doctors, really highly skilled, the sort of thing that Alison was talking about. So this is the state seeing a very good way of saving money and wrapping it up in something that is sort of giving carers rights, but it's not. It's actually transferring risk to them, and also obliging them to be there, as Alison says, 24/7 for 3 months. And the English government has said, oh, it's a really interesting piece of legislation. We need to have something like that. And we're not very happy about that, putting it mildly. So there is this outsourcing of risk, but there is also this sort of Nancy Fraser idea of it being fairly progressive, in the sense that obviously people don't want to be institutionalized. Many carers do want to provide care. And many carers think that they will provide the better care than will be given by the state. And all of those things are really positive. But there has to be compensation for that. If the carers are saving the United States $81 billion, then some of that could feed its way back into the pockets of carers without being means tested, without risking losing it all and having huge backdated claims because you worked 1 hour more than you should have and things like that. So the way I think that you address the disadvantage of disadvantaged groups, and there's a good literature in the US on race and particularly on women, is just serious, non-means tested Social Security benefits for people that are doing these jobs, that they don't lose them, clawed back if needs be through taxation of the wealthy, and seriously positive employment rights with significant state compensation for people that give up work, because in the UK over 3 million carers give up work. Highly qualified, trained people give up work to provide care. And those are things that the state really doesn't want to do, even though probably from a sort of, if you zoom out a bit, it would make economic sense in the sense that, of saving, the nation a huge sum of money. And until we get those really serious social welfare rights, we are going to get these sort of opiates, which there is so much legislation now in the UK that uses the carer word or the caregiver word, but that it almost emphasizes the problem, because on all well-being indices, and I see that Australia is leading on doing well-being tests of disadvantaged groups. They have gone backwards and backwards and backwards, and you must know that, Eleanor, and Alison and Kate, as I do.
I mean, absolutely. That's the thing. I think we've got, well, again, going back to what you said at the beginning, we've got these pieces of legislation, but at the end of the day, is it making a difference to carers on the ground? I think there's good intent in some of the things, but it doesn't necessarily have that next level, I suppose, which goes then, I suppose, a bit to my question to Alison, which was, is legislation enough to give carers access to the right information and support? I think we know the answer to that. Or does that legislation need to be supported by other initiatives? And I suppose that's what we've started to sort of hint at. So maybe can we think about, and in your context, what's worked well and what needs to be improved, and where's that gap, and how do we fill that gap? Obviously, Luke's talking about the welfare-based rights, system. Are there other things as well as welfare and payments and that sort of thing?
Well, I want to start by saying I really love this phrase, outsourcing of risk. It's new to me, but it so resonates with everything I see in terms of this profound physical, emotional, spiritual, existential, and financial distress experienced by family caregivers. And just to put another number on it, that Luke gave us 80-something million, but in late 2023, the efforts of caregivers in the United States was estimated at $600 billion. Despite the fact that 25% of family caregivers report high financial strain, have difficulty putting food on the table. So there's a huge disparity between the efforts being put forth and the experience on the ground. Now, is the policy enough? Of course it's not. Otherwise, we wouldn't be here this evening or this morning. The reality is that, the CARE Act is an example I'll go with. It doesn't specify who provides that training, when that training should occur. Additionally, even if it did specify those two pieces, we likely are then adding an additional responsibility onto the plate of our already way overburdened nursing staff in hospitals. And so one of the big pieces comes up, the existential dilemmas come up around, do we have the infrastructure in our healthcare system to provide that training and education and downstream support? And I say support because when I think about the CARE Act or any other legislation, I also like to think about them as opportunities. So I think, at least here in the United States, oftentimes it's very difficult to identify a family caregiver, to connect with them. And if you actually have that one-on-one interaction, well, that's an opportunity that we should capitalize on. And as a clinical psychologist and mental health professional, my perspective is, let's take it a step further and not just identify a caregiver, teach them how to take care of their care partner's catheter bag, but also, why don't we screen them for their unmet needs, ranging from the psychosocial to the financial, and then triage them to appropriate levels of care? The problem with that is the existential question of how in the world do we provide that support? I think that with these policies in place, nothing will change if there are not additional policies that say we are going to delegate this, earmark this amount of funding for each hospital system to have another social worker, another psychologist, another nurse whose explicit role is to help implement the CARE Act. I strongly believe if each healthcare system here in the United States had that one social worker funded, my answer would be completely different. But without that role, without that infrastructure, it falls to the masses. And we all know social psychology, if it falls to the masses, no one's going to do it. And so my answer is that I think we really do need to think about the infrastructure necessary to carry forward these policies. I think there's a lot of potential, but we are really missing the mark.
Yeah, absolutely. I think it is that I can see that there's a lot of sort of comment in the chat, just things, just different ones that are popping up around being inclusive of the whole family, not just, I suppose, identifying one carer, but the impacts across the whole family and being inclusive of the whole family in some of these ongoing rights and supports and things as well. Yeah, so we have a bit more of a chat about that at the end as well. So, Kate, just coming to you, the path to establishing a right to a short break for carers obviously has been a long one in Scotland. Can you talk to us a bit about some of the challenges of the parliamentary process when establishing rights for carers? And do you have any advice for navigating this?
I think it's a very good question. So the right to a break from caring forms part of a vastly complex piece of legislation called the National Care Service Bill, which is currently going through the Scottish Parliament. The right to a break just forms one very small part of that. Interestingly, the bill going through Parliament has called what has been termed a framework bill, which means that a lot of the detail is planned to be worked out through regulations and guidance, which brings a unique set of challenges. It's very hard to see how the different pieces of the jigsaw fit together because there isn't that level of detail there. And that makes it extremely challenging for people to scrutinise how that legislation will actually be implemented and how it will work in practice. With the right to a break, the portion of that bill there is more detail. However, one of the difficulties with it has been the tension between national legislation and local model of delivery and how that will actually work. So while Scotland is a very small country in comparison to Australia and the United States, we have a population equivalent of Queensland and a land that's maybe about 5% of that state. So we are a very small compact population, but there is this tension between national government and what's devolved to our local authority areas and how things are funded. The challenges with this piece of legislation, as Alison and Luke have rightly pointed out, it's to do with funding. You know, we're in very challenging financial times, and that's not going to get any easier. In terms of influencing the legislation, I think that one thing that we do massively benefit from in Scotland is our proximity to our parliamentarians. We have a very open system in Parliament, and it's very easy to access for organisations like ourselves. So we've been able to give evidence to the committee that taking the legislation forward, there's opportunity to make contributions and written contributions and to meet with different parliamentarians and our policy unit at the Scottish Government we have regular contact with. So being right at the centre of it, having those conversations is hugely beneficial. For example, we sit on a working group that's actually looking at some of the regulations and guidance around the right to a break. So we're right at the heart of the discussion, so we're able to bring forward the views of carers through our own consultation exercises and make sure that they are represented. So that's been hugely beneficial in terms of shaping the right to a break. The big challenge, though, will be, I think, this legislation is coming down the track, possibly 2027, but carers can't wait. So it is very challenging to be saying, oh, when the National Care Service comes in, everything's going to be fine, don't worry. But actually, we know that services are closing, we know that carers are facing financial challenges, that the barriers to them being in sustained employment exist, and there's an increase in caring responsibility, and that outsourcing of risk definitely has hit up the point for a lot of people. We talk about carers in Scotland being willing and able to care, so it's not just that it should be something that is expected of them, but they should be able to see whether they are willing and able. And also we talk about a life alongside caring, so that caring is just one part of what makes that person, and what outcomes that they want in their life are really important, equally important as well. But in order to deliver that, you have to have money to fund the services that sit behind it. And we do have some pockets of really fantastic practice, particularly around preventative agenda. So we have what we call easy access to short breaks, which is non-means tested small grants that every carer can access, which is the equivalent of £250, £300, and they can use it to spend towards anything that might give them a break from caring. And that's, we know of examples where people have bought hen houses, garden benches, Kindles, treadmills, and it's such a fantastic way that small amounts of money can make a massive difference. So in terms of policy extension, I think there needs to be, yes, we do need to have these pieces of legislation like the right to break from caring. It's the right that we are ambitious for our carers and that we want to see these rights progress. But we also have to recognise that this parliamentary process is very, very slow, and that carers need more support, and they need it now, and they need investment, and they need to be able to access things in a way that's not complicated or is it's not deficit based. So it's about what positive things they want to have in their life, rather than how bad are things before you can get support. So I think for carers there is a huge sense of frustration about the pace of change and what's actually needed now, rather than what might come 3 or 4 years down the line.
Yeah, I mean, it is. I mean, carers can't wait. And I think, we've talked about where some of the gaps are, where funding and other things are needed. But it is a very competitive space. There's a cost of living crisis. It's affecting, all different areas of the community and everything else. And carers are one component of that. So it is how you compete for those much needed funds to fill those gaps, to enable these things to actually be implemented properly. Because I think what we find here is that you can have a service system, but there can be a gap in the availability of services, particularly in remote parts of the country where it's just not possible to be able to deliver on something. So it's not having that universal availability of supports and services as well to back up the legislation that provides that overarching framework. I think just quickly to Kate and Luke, earlier this month, the new Carers Leave Act came into force. What difference do you think this will make for carers in England and Scotland? Based on your experience, do you see any challenges in the implementation of that? More of the same.
Kate, you probably are better based to answer that than me. I've got views, but
I'm not sure I am. I think it's a step in the right direction. I think that anything that raises further awareness of the challenges that carers experience in balancing all the different things in their life, caring responsibilities, employment, and so on, it's got to be a good thing. But there's a much further to go. It's unpaid leave, so financially, as Alison pointed out, the financial strain on families where there's a disability and caring responsibilities can be enormous. So the fact that it's unpaid doesn't alleviate that. In terms of carers, what challenges that they're facing. And I think as well, the cost of living crisis that we're facing in the UK also means that anecdotally, we're hearing that many more families have got 2 working adults in them. So it's much more difficult to sustain the caring and the employment. So I think it will make some difference, but there's a lot further to go. But again, pockets of some good practice. We've got a scheme in Scotland called Carer Positive, which is about encouraging employers to have in place policies and standards that support carers within their own workforce, and there's some fantastic examples of that. So I think if carers leave can be also run in tandem to some of these initiatives, really encouraging best practice, I think that would yield some more positive results for carers.
Yeah, just I mean, again, it's risk. The UK social care sector has collapsed, basically. It's been completely undermined by sort of 20 years, 15 years of austerity. And the British economy has been completely collapsed by austerity. I mean, we're the petri dish for what not to do in economic terms, because we've cut and cut and cut. Social care's got worse, health's got worse, education's got worse, and the economy's got worse. And when the social care is as bad as it is, what the state is saying is, well, we'll give people time off from employment to go and provide this emergency care or this general care. We'll give them a break so they can go and sort of work in the fields, you know, during the harvest time. You know, basically it will be good for the economy. But these people, many of them are, you know, consultants working in the health system. They're professionals teaching. They've been, you know, the state has invested huge sums of money in giving them expertise, and now we're being told that they can give up that expertise and do something that could be done by somebody who has a vocation for it, but doesn't need the sort of skills they've got. Whereas we have these huge teacher shortages, and we have all these crazy sort of shortages within the health system. And what the state can't do is to zoom out and just see that this is an absurdity. You know, we do need to keep people in work. The UK is losing 3 million people, mostly women, every year because of caring responsibilities. The UK economy, the only asset it's got is its people and their education, and it's being sacrificed because there's just one sector, which actually isn't a very expensive sector compared to health or education or some of these other things, that has been starved of funds. And we really need a sort of grown-up economic discussion about this sort of doesn't make any economic sense for a country to lose all of these highly trained people to do these menial, relatively menial tasks. And it's not decrying them, but they're not tasks that require the skills that many of the carers who are giving up work have. And it's treating a sort of complex, messy system, which is social care, as a simple linear thing, that you just save some money here and then, you know, it's good for the economy. Whereas in fact, it's the opposite, as John Maynard Keynes told us very clearly. So yeah, somebody needs to be saying that this doesn't, on a macro level, make any sense at all. But that's my rant over for the evening.
I mean, it is. I mean, as you said, it's not linear, but also by removing people out of the workforce, you're creating other problems because you're creating impacts on their own health and well-being, you know, their own physical health, all of those kind of things, if they're taking up that caring role without the support alongside it, often as well. So you've not only got the economic impacts, but you've got those, you know, the well-being impacts as well. That it is a very complex thing. And again, you know, try to fix one thing here, it causes and creates a problem somewhere else, which I don't think, as you said, they need to zoom out and look at all of that continuum of problems that it seems to be being created and not being addressed. So it is a bit of doom and gloom, but there are lots of positive things happening. So I think maybe just to finish the questions here, and then we can go to sort of questions from the audience. Just to each of you, do you have any parting advice for us in Australia as we develop and review a number of pieces of legislation and laws affecting carers? So, Alison, I'll go to you first. on that one.
Absolutely. There is a growing body of literature that states and shows very clearly that when we provide psychosocial care, mental health care to family caregivers, that they are better able to take care of their care partners, and they're able to do so with much less detriment to themselves. And I think that alone is a really important piece of data, that that amount of support can make or break the outcome down the line. I often say that without support, family caregivers represent the next generation of patients with chronic and life-limiting illnesses. But if we can provide that support right now, when caregivers are in that role, then we actually can prevent a lot of those poor outcomes. That psychosocial support for caregivers has benefits for caregivers, for patients in the healthcare system more broadly.
Yeah, absolutely. Kate, any parting bits of advice?
I think I would say keep going. And I don't mean that in a trite way. We have got this process in Scotland that's taken us from recognition of carers to the Carers Act, which implemented new rights. And now the next evolution of that is the right to a break from caring. And I think sometimes it's very easy for us who are deeply passionate about support for unpaid carers to think the mountain to climb is huge and we'll never reach it. But it's important to remember that we are reaching summits along the way. So the rights that came in with the Carers Act were a step forward. The right to break from caring is another positive step forward. So just keep being ambitious for carers, and I think that we do see progress, and it's important to reflect on that as well.
Right. Thanks, Kate. Luke, final bits of advice for us?
I mean, we must be positive. I really like Alison's point. When we met in Australia, Elena, you had a really inspirational speaker talking who'd spent, I don't know, 15 years at Melbourne doing well-being indices tests, and sort of having a sort of benchmarking, saying to the state, look, make a commitment that you will increase the well-being indices of carers, independently measured by Melbourne University or whoever's doing it. Focus on that psychosocial support, focus on, do all of these things, but come up with something that will move the dial, basically, move the graph up from down. And also sort of do a couple of pilots, which really won't cost anything, or you can get some sort of charitable foundation to pilot having a social worker there or a psychosocial support system. Just pilot it in one town or one rural area and see if that moves the dial, basically. But yeah, use well-being indices in the academic sense as a measure, and make a commitment to do that, independently verifiable. And that would be quite, it would be difficult to see why they should refuse to do that.
Yeah, I mean, we are doing some work here in Australia through sort of the National Carer Gateway, starting to collect some of that information and benchmarking some of that as well, so that we can see whether there is that improvement, when carers do get support, don't get support, and trying to measure that and have a look at that wellbeing across the spectrum as well. So, thank you, everybody. I think what we might do is just move to whether there's time just for a few questions, and I might just hand over to Sarah to access those questions through the chat to put to panel members before we then end the session in the next sort of 5 to 10 minutes.
Yes, no worries. We've had a lot of comments in the chat, which is fantastic.
I keep seeing different things popping up, and I think it's probably easier if you manage the questions at your end, just given where I am at the moment.
Yes, no problem. We've had, I think, 3 questions. So if we start in the Q&A, we had a question from Michelle for Luke. If you are suggesting a call to action by carers in an age when so many marginalised groups are vying for limited funding and recognition, what is something practical that carers can do at their local level? Empowering carers' voices so that they are not lost in the sea of voices is often the challenge.
Yeah. I think one of the things is to realize that carers share an awful lot of common experiences with other disadvantaged groups. And one of the lessons that we know from disadvantaged groups in tackling the sort of oppression which carers experience, they're punished for caring, they have bad incomes, they have bad health, they have bad well-being, is to form alliances. So I think the most positive thing that carers can do is to form support groups of people with experience, and your organization in particular is hugely important in being supported in bringing that sort of message to those in power, as Elena's going to do later this morning. So it is to get that emotional support from other groups. Lobbying is something I think that, and obviously in the UK is sort of writing to MPs and doing things like that, but that probably is something for Carers New South Wales to do. But just giving emotional support and receiving emotional support to keep you persevering and keep you from feeling it's just you. It's fairly bleak, but I think that's the advice I give.
Thanks, Luke. And we had another question from Lottie, which is that carers are supporting a variety of needs. How can legislation be sufficiently broad to cover all of these, but enough recognition and funding for specific challenges? As much of the details are worked out in implementation, how can the specific challenges, for example, of young carers, of those supporting highly stigmatised mental health or AOD disorders, be particularly supported and not left to fall through the cracks as normal?
Is somebody volunteering to ask with that, or was that me again?
I think to anyone that would like to pick that one up.
Well, I picked that up because it's one of the challenges that we're discussing around the right to abuse legislation. How do we make it flexible enough that it can be applicable to a wide range of carers, but not so flexible that for duty bearers it's a get out of jail free card, but specific enough that it can also be meaningful. And I think that it is a challenge, and in our piece of legislation, the word sufficient is doing a huge amount of heavy lifting, because that's how the right to abuse is going to be defined. But I think there are a couple of things. There's organisations like ourselves who are making sure that we try to represent this wide variety of carers, the diverse range of carers and their views, and also lived experience. So making sure that those lived experiences of carers and who we care for are represented through the opportunities to influence legislation, whether that's giving evidence to committees or holding roundtables and so on. So I think that needs to be at the forefront. And then I also, in the work that we're doing, it's around making sure that there's guidance contains things like examples and case studies that do represent the diversity of caring, so that the people can recognise their situations in guidance and regulations, so that they know how it will apply to them as well.
Third question, 3 out of 4 so far. So we had Nissa ask in the chat, are carers regarded as their own separate population for intervention in the UK?
Well, there's carers legislation, and they have specific rights, and so I suppose they are considered. it's very difficult to distinguish legally between somebody who provides care and somebody who needs care, because normally the way you support somebody who provides care is by giving them a break and then providing additional replacement care for the person that needs that care. So the two are inextricably interlinked. So there is carer-specific legislation, but it can only really exist in the context of it interlocks with legislation concerning disabled people. I think just quickly about definitions. When we first drafted the Carers Recognition Act, which I was involved in 95, everybody was really keen to define carers very clearly as a specific group, and they had to be providing regular and substantial care and various other things. That's completely gone from the legislation now. They just describe carer as somebody who gives care. Full stop. These definitions are not really that important in practice because there are other mechanisms to deal with that. And so these groups are very large, and they obviously people coming in and out of caring all the time and merging. But in practice, that doesn't, in legislation terms, that's not a problem.
Thanks. I think.
Sorry, we do have a couple more questions, but we might have run out of time, Elena. Did you
Yeah.
want to
I think probably, I think, look, great discussion. I think it's raised probably more things for discussion and debate. And I know that there's lots of different perspectives on the chat, bringing in, different population groups of carers as well. Carers of people with a mental illness and the isolation that they feel, carers of people with alcohol and other drug issues, those things, young carers in particular, but also looking at caring within the family context, which I mentioned before. There's been a lot of comment within the chat about all of that as well. But look, I think thank you to all of you, Alison, Kate and Luke, for your time. And I know it's quite late in the evening in the UK and earlier in the evening in the US, and coming up to 9 o'clock here in Australia. But thank you so much for your contributions. I think it'd be an opportunity to down the track pick up this discussion a little bit more as well, and different aspects of it, because I think there's so much more that we could cover. I mean, I think the clear message is, and the kind of, I suppose, overarching call to action is that legislation is an important tool. It's one piece of the kind of the big puzzle to support carers and to recognise carers, but it's not enough on its own. And there's a whole lot of other things depending on where you are, what your situation is, what your country's doing, or your state or territory, that needs to come in underneath that to make that legislation, to really implement it, to make it meaningful, and to actually then create real change for carers that is going to be sustainable. And provide some choice as well. So I think lots of really good things to think about and talk about, and I'm sure those conversations will continue with the people that have participated today and attended today, but also through obviously those that will watch the recording into the future. So again, thank you so much. For the audience, there is a poll that people can feedback on there now, which would be great. Wonderful. Lots of participation and a really broad range of participation. So thank you, everybody, for that, which is fabulous. And I'll just plug the next Care Knowledge Exchange event, which is our Care Knowledge Exchange Research Incubator, which is the focus will be on sustainability and caring, and looking at that sustainability from a whole range of different perspectives, not just about sustaining the caring role, but economic sustainability, financial sustainability for carers, and a whole range of other things. So again, thank you everybody so much for your participation today, and we'll finish up there. So thanks so much.